Dear friends, my name is Francesca Sofia, and I am the president of the International Bureau for Epilepsy, or IBE. Firstly, I want to thank you for joining us in celebrating International Epilepsy Day 2024. This initiative is more important than ever as the epilepsy community comes together and calls on governments around the world, such as yours, to work with us to implement the World Health Organization's 10-year intersectoral global action plan on epilepsy and other neurological disorders, which we call IGAP. IGAP was unanimously adopted by all WHO member states at the World Health Assembly in 2022, almost 2 years ago now. We now have 8 years remaining, a very short time to ensure we can achieve its 10 global targets. Importantly, IGAP contains a specific strategic objective to strengthen the public health approach to epilepsy and to associated global targets aiming to close the treatment and inclusion gaps for people with epilepsy worldwide. Today, I want to specifically draw your attention to IGAP Global Target 5.2. This calls on 80% of countries to develop or update their legislation with a view to promoting and protecting the human rights of people with epilepsy by 2031. One of the key barriers to achieving this target is the low level of health literacy and the high level of misunderstanding and misconceptions about epilepsy. This lack of knowledge translates into social stigma and exclusion, and leads to the discrimination of people with epilepsy across all levels of society, for example, at work, at school, or in the community. Lack of knowledge can also contribute to challenges in access to treatment due to misdiagnosis, to inappropriate treatment decisions, inadequate provision of care, and insufficient support for people with epilepsy and those who care for them. In fact, due to the stigma surrounding epilepsy in many parts of the world, those affected will not come forward to seek care. Additionally, lack of knowledge also hampers the prioritization of epilepsy by our policy and decision makers and leads to a failure to acknowledge the need for specific policies and programs to address the burden of epilepsy. This needs to change. This International Epilepsy Day, I want to thank and congratulate all of you who are working to raise awareness of epilepsy and advocate for the rights of those affected. I want to commend the work being undertaken at the national, regional, and global level. But we need to accelerate our efforts. My plea is for all stakeholders to join with our IB chapters who are leading such efforts to ensure we can together achieve a transformational social change for people with epilepsy worldwide. Thank you.